Hi, my name is Matt Van Vranken. I'm the president of Spectrum Health Hospital Group in Grand Rapids, Michigan. We are an integrated delivery system that includes 3 corporations. We're about a $3 billion company, 17,000 employees. I really view success in the transformation of this healthcare system as our ability to really create something that has end-to-end connectivity. And it's not about a system, it's about how people behave and how they view their roles within a healthcare system. In order for us to be able to create connectivity end-to-end, we need to influence a number of people across this organization. We believe that there are 3 vital behaviors that are going to make that happen. The first is for people to take responsibility for their own actions and behaviors. Really focus on those things that we believe are most important. The second is for us to be able to create an environment where people feel safe to talk about those things that are most important, and where we can be able to begin to really have the kind of conversation that will allow us to be able to break through literally 50 or 60 years of hospital culture that finds us where we are today. And then finally, we really have a holistic approach to accountability, which says I'm going to be accountable for the things that I do, but I'm also going to hold my peers accountable for the things that they do. In order to focus on improved hand hygiene, people obviously have to speak up and to hold people accountable. We've used crucial conversations to really drive our culture and behavioral change. But we understood that the dynamics in that particular space were such that we really need to understand better those things that influence behavior. And so we've used the influencer model to be able to drive change, quite frankly, that I would say is probably going to be best practice in the country.
When we went through the 6-source brainstorming tool that we used, we found that we had done a lot of the interventions one at a time, sequentially, over the past several years, and they had been unsuccessful. The value of the 6-source model was the realization that there was no such thing as a silver bullet, that if we were going to be successful, we had to use all of these initiatives, all of these interventions together to drive to our goal.
We've really seen dramatic results in hand hygiene and compliance. Prior to using the influencer model, we were getting the kind of results that I think most of the hospitals across the country get, less than 50% compliance. Since we've used this and since we've driven this cultural change, we are now in the 3rd quarter, so 3 quarters in a row, we've seen over 90% compliance in our hand washing, and we're driving very, very vigorously to 100% compliance. As people have learned to hold each other accountable for something as simple as hand hygiene, it's a skill set that they're using to hold each other accountable for other outcomes that are expected. Patient safety, quality, efficiency. It really has provided us with a cultural framework to drive high performance broadly within the organization.